Hello and welcome to the College of American Pathologists Media Briefing, which is also live streaming on YouTube. Thank you for joining us today. My name is Dr. Emily Volk. I am the president of the College of American Pathologists, and I'm also the vice president of pathology and clinical laboratories for the University of Louisville Health System, and an associate professor of pathology at the University of Louisville School of Medicine. This morning, we are joined by a learned panel of CAP members to discuss artificial intelligence and its role in pathology. Joining us this morning for this very important discussion are Doctors Patricia Rossetti, Matthew Hanna, and Eric Glassy. Will all of you please tell our audience a little bit about yourselves, starting with Dr. Rossetti?
Thank you, Dr. Volk, and thank you for inviting me for this important discussion. My name is Patricia Rossetti. I am a board-certified pathologist, and I'm a member of the College of American Pathologists Digital and Computational Pathology Committee. While practicing pathology for a number of years, I was also involved in the design and development and extensive testing of numerous computer vision algorithms applied to digitized histopathology images. Since then, I've transitioned to the pharmaceutical industry, where one of my roles also involves the vetting of these computer vision algorithms. Thank you.
Dr. Hanna?
And so it's a pleasure to be here. Thank you. My name is Matthew Hanna. I am a pathologist at Memorial Sloan Kettering Cancer Center. My predominant focus is in breast cancer, as well as being the director of our digital pathology informatics group. So I sign out breast cases, which is effectively reading patients' tissue and specimen and reporting on those as my clinical service, and then leading the other clinical informatics initiatives within the department.
Thank you. And Dr. Glassy?
Hey, thank you, Dr. Volk. It really is a pleasure to be here. I am a community pathologist. I am part of a larger independent pathology medical group called Affiliated Pathologist Medical Group. We are primarily located in Southern California. There's 40 of us, but we also cover in Oregon and Arizona. In terms of the CAP, I'm a past governor of the college. I've been involved in many councils and committees over the years. And currently I chair the Information and Technology Leadership Committee, and a subgroup of that committee is involved with generative AI.
Well, I thank you all for being here. The term AI, it's everywhere today. I want to take just a few moments to explain the terms artificial intelligence and machine learning. The American Medical Association has suggested the use of the term augmented intelligence. Dr. Hanna, can you talk about the importance of this term, and is it perhaps a much more realistic phrase when talking about AI and the care of patients?
So I think it's exactly the right term that should be perpetuated when talking about AI and using AI as augmented intelligence as opposed to artificial intelligence. So artificial intelligence seems to indicate that there is a seamless decision automatically happening by a machine or robot, whereas a lot of these assistive workflows that are being developed as part of these decision support tools, these machine learning based systems, are being used in an assistive fashion and augmenting the role of the physician, the role of the pathologist in their day-to-day tasks. And so I think using AI as augmented intelligence is a much more descriptive and accurate use of the technology and how it's being developed today.
So we really need to be thinking of this as a tool that a physician uses, just like pathologists use microscopes. We're now incorporating this additional tool into our workflows. Dr.
Exactly.
Glass, go ahead, Dr.
These
Hanna.
tools have, the pathologist has an armamentarium of tools that are available to them, like immunohistochemical studies that look at the protein expression of the cells. And so these are assistive workflows. These are yet another tool that the pathologist has access to them to actually review patient tissue and help write their patient reports and give them to their downstream patient-facing clinicians.
Thank you so much. Dr. Glassy, let's talk about machine learning and what does that mean for pathologists and what could it mean for our patients?
Machine learning is a type or a subgroup of artificial or augmented intelligence. It's teaching machines, computers, about a particular topic, and the computer learns on its own and comes up with a diagnosis or a procedure or a task that's completed. So in pathology, we can use machine learning or a more computer intensive operation called deep learning to come up with an analysis of some very complex topics like the molecular basis of cancer. And these two help pathologists better give precision diagnoses about a patient's particular disease and tailor the diagnosis to the individual as opposed to the group. So the combination of machine learning, which is sort of like a video game in which you get better and better as you play it. The computer learns from itself and gets better and better at what it does. And then there's a subgroup, a more computational intensive type of machine learning, which is deep learning. And that's where much of the activity in medicine and in this case, pathology is being focused on. There's so many opportunities here for us to help our patients.
So, as we talk about these technologies, how do we think they will affect us as pathologists, our specialty, and more importantly, our patients? Dr. Rosidi, you work in the pharmaceutical industry. Can you share how, as a pathologist, you are using AI?
Absolutely. Machine learning algorithms applied to computer vision can touch many aspects of the drug development process and pipeline. Most simply, we can use computer vision algorithms to characterize and quantify the immune cells in and around the tumor and potentially gain a lot of biological insights into the disease mechanisms themselves or the efficacy of treatments that we're developing. And on the more sophisticated side, machine learning algorithms can now be used to screen for genetic alterations that are found in the tumor tissue on a digitized histopathology slide, potentially offering a more efficacious, less time consuming, and less complex determination of the genetic alterations in the patient's tumor. And this can help us guide which treatments might be more efficacious because they're targeted for that specific mutation or genetic alteration, to which clinical trials might be most appropriate for patients. So again, it's really become a bedrock for us to be able to provide the most effective therapeutics, especially in the world of cancer treatment.
That's incredible. Dr. Glassy, from your perspective as a community pathologist, what does AI mean for your practice? In what ways have these technologies been helping you and your patients?
Well, I think the bottom line is pathologists need to make the most accurate and correct diagnosis they possibly can. And I use whatever tools are available to allow me to do that. So I use image analysis every day in my practice. And that entails looking at a digitized image on a computer screen. It is a number of, let's say, breast cancer cells, and we've applied a particular stain to those cells, estrogen or progesterone or HER2/neu. And then in the past, we used to count the number of cells that are positive in their staining characteristics manually. But with the assistance of artificial intelligence, with the assistance of image analysis, computational algorithms, I can be much more accurate and provide clinicians a much better picture of what treatment is best to start a patient on their journey.
Thank you, Dr. Glassy. Dr. Hanna, you work in a major cancer center. How does AI inform what you do in your practice?
So it's a great question, and I think all of these assistive workflows can be taken one step further to now be trained and validated to actually assist pathologists to detect tumor in itself. And so there are cancer detection models available, whether it's prostate cancer detection, breast cancer detection, metastatic cancer to a lymph node. So all of these assistive supportive workflows can help screen or be used as a second read, having a virtual consultant where these machine learning models effectively can highlight or wherever they predict actually to have where these tumor cells might be present. And that way the pathologist is able to use these to determine, are these actually tumor cells? Are they false positives? But at least the pathologist has a way to have a virtual consultant pre-screen or be used as a secondary reader to actually detect where these tumor tissue might be present. And this can help the pathologist triage their cases accordingly, so that way they can actually look at the patients who have cancer more upfront and perform and order those ancillary studies so that they can so they can be processed in the lab sooner, and that those patient reports can be finalized much sooner than if they were waiting until the last case of the day before they actually found in their analog workflow when they did not have that assistive or supportive work from the machine learning models.
Thank you, Dr. Hanna. So you've mentioned already a little bit about how pathologists are using some forms of AI. I would like to talk a little bit more about some of the FDA-approved AI tools in anatomic and for anatomic pathology for making primary diagnosis. Aren't they meant to be more quality assurance tools to use after a pathologist has reviewed and studied these slides and images? Dr. Hanna?
So there are several FDA-authorized tools that are available to pathologists today. And originally, as Dr. Glassie was mentioning, those are those image analysis tools that are predominantly for breast biomarkers or hormone receptors like estrogen receptor, progesterone receptor, HER2, Ki67, et cetera. These are protein stains that will really help pathologists need to order on every breast cancer case and report the number of cells that actually have that protein expression, so that their medical oncologists or other patient-facing clinicians can start management and treatment of those patients depending on their biomarker profile. So one of the earliest examples of FDA-authorized image analysis were exactly those, and those have been around for some time, and many pathology labs have access to those today. Taking it one step further, moving towards detection, there are in the cytology world the ability for pre-screening of cervical cytology. So as women go to their gynecologist and have their pap smears, there are tools that actually allow the cytology preparations that come from those, the cellular preparations, to actually be pre-screened by a machine learning-based model. And then the cytotechnologist or pathologist is able to review those areas that it's thought that the machine learning model thinks are suspicious to ultimately make a decision on. And again, as I was mentioning before, there are now more newer tools or recent tools that have been available as FDA have authorized them as software as a medical device to ultimately help detect areas of tumor in a histopathology image for prostate biopsies, routine stains for prostate biopsies to help detect prostate cancer. And so these are, again, all tools that pathologists have access to use in an assistive workflow, again, for reporting of those to ultimately provide the most accurate, best patient care they can possible.
I think it's important to highlight, the theme of what I'm hearing you say, Dr. Hanna, which is the pathologist has access to these marvelous technologies, but ultimately it is the pathologist as the physician practicing anatomic pathology and laboratory medicine making the diagnosis, that these instruments are not making the diagnosis. That is physician work. And these are just tools that augment that ability. Dr. Ricidi, you have been on the development side of these tools. Can you explain a little bit about why working with an actual pathologist is such an important part of informing AI development?
Absolutely. Needless to say, it's absolutely crucial. If we take a step back out of medicine, even the development of a tool or a product, often the developer has in mind the end user. And if we think of most industries, the autonomous vehicle industry, for instance, The developer of that tool and software is typically also a driver, him or herself. That's not the case with in the medical field, especially in the field of pathology, which can be highly complex and extremely subspecialized. And so it is crucial for the developer and the subject matter expert, the pathologist, who will also be the end user, to work hand in hand from the beginning of the development process, starting with the intended use of that algorithm. Does it make sense? Is there a need? To the curation and potentially interpretation of the correct data set to train that algorithm, to ultimately the use of and the vetting of that algorithm, not only on a standalone basis to test how performant it is, but importantly, how it is used in the hands of the pathologist, the end user, so that it can be the most positively impactful on the patient. This is a crucial step in ensuring that the tools that are created are not only efficacious, but also safe.
Absolutely important. And that really brings me to the next question. I've heard this over and over, and that's, will AI replace pathologists? And I can tell you from my perspective, I think we can sum it up by saying that uh, AI won't necessarily replace pathologists, but pathologists who use AI and use it well will replace pathologists who don't. But Dr. Glassie, what's your perspective on this?
Well, artificial intelligence is a powerful tool, but it is just a tool. It is not human. Uh, as a pathologist, I have access to many different types of techniques and stains and laboratory studies that all can be focused down on exactly what a patient needs to make uh, their treatment journey begin. So the diagnosis is a centerpiece of medicine in terms of how patients are um, eventually treated. As a pathologist who creates that diagnosis, I want to be sure I'm using the most available and appropriate tools I can. And artificial intelligence algorithm is going to be just that, just a tool and not replacing me. I can see it can replace some mundane tasks. I think it can replace some activities that a pathologist finds more challenging or grueling, and that it can allow us the time to properly analyze and think through the diagnosis. But at the end of the day, the pathologist is the one that makes the decision. You need a human to be able to initiate this treatment journey. And so pathology is going to see a revolution when artificial intelligence, augmented intelligence becomes more and more inculcated in what we do. It will transform our practice, but it will not replace the human aspect of what we do, the human aspect of medicine.
Dr. Hanna and Dr. Rossetti, what are your thoughts? I'll start with Dr. Hanna.
I completely agree with Dr. Glassia. I think these machine learning, artificial intelligence based tools are really focused on very narrow, specific tasks. They've been trained to do one thing quite well or to the best of its ability. But at the end of the day, these are just one of many, many tasks the pathologist actually reports as part of their review of all of the patient tissue and of all the things they end up putting in the patient's report for the surgeon or radiologist or other patient-facing clinician to then go and interpret. So all of these very narrow, specific tasks that these models have been trained on can again just do one or a few things that the pathologist is reporting. I think we are still needing pathologists, as there will be potential shortages of pathologists in the future, even today, that they are helping pathologists do those tasks very well, but the pathologist is still needed to make a definitive decision and diagnosis based on what those machine learning model is predicting, but then also for all the other tasks that they have not been established yet in the machine learning world, where the pathologist is still doing all of their other routine tasks without support, as they would normally do that today.
And thank you. And Dr. Rossetti, your thoughts?
I also agree with what's said. I think pathologists remain and will remain the center of that pathologist diagnosis process. Pathology is a vast and complex field. I'm thinking of just cancer diagnostics alone, which is just a subset of what a pathologist does. It is a generic name for, dare I say, hundreds of diseases that look very distinctly different under the microscope. Not only does a pathologist have to detect and properly classify cancer, but that's just the first in a series of tasks that a pathologist has to do. From cancer quantification to localization to assessment of severity. And that's just to assess what is on the slide. More often than not, pathologists are looking in the patient medical record, having discussions with radiologists on radiographic findings, having discussions with oncologists, surgeons on the state of the patient, and integrating all of that information along with what they see on the glass slide to render the most accurate, definitive diagnosis for that patient. And to as Dr. Hanna said, there are robust algorithms that can do a thin slice of this process and they can be used. But ultimately, at this stage, the process is so nuanced and complex that to provide the best care from the patient, the pathologist is still the central figure. Pathologists are here to stay.
Yeah, I couldn't agree with you more. I mean, ultimately, we're still physicians and we're still taking care of patients. How will AI help pathologists, especially in rural areas here in the United States, well, and around the world? Doesn't this help foster better diagnoses and sharing of expertise among other pathologists, which may, of course, benefit patients? Dr. Hanna?
I think this is one of the great promises of artificial intelligence where there will be a democratization of expert level pathology knowledge. And so a lot of these machine learning based tools have been built on, at least the high performing ones have been built on high quality data from expert institutions where there's expert subspecialists, and all of the data that they have to train these data are really the best quality they can be. And so as these machine learning models learn from all of this expert level data, they're inherently learning that expertise, and that expertise is now a piece of software that can be deployed in resource restricted countries, rural areas, underserved areas, and all of these learnings now can be used for those pathologists who already have a shortage, and also be a virtual consultant, have an expert consult for them as a piece of software, so to speak, that they can use just like they would have an expert pathologist in the room with them as they're looking at the glass slide. So this democratization of pathology expertise is really, I think, one of the big promises and advantages to deploying these sorts of software across the world.
Now, I appreciate you mentioning that. I think, um, it's easy to forget the role that pathologists can play, even from the laboratory, in contributing to bridging gaps and health equity. And this is one of those opportunities. Dr. Glassy, tell us your perspective from the community pathologist's seat.
Well, when I first started in practice, I was at a very small hospital, just 100 beds. It was granted in a suburb of Los Angeles, but the nearest larger medical center was 10 miles away. And when I had a challenging case, I had to either drive over and share the case with colleagues or ship the case out to an expert consultant like Dr. Hanna, who's an expert in breast pathology. If I had a complex breast case, I would have to FedEx or UPS the case out to him, and there would be a delay in getting a diagnosis. You know, these tools in pathology have just dramatically improved how I can practice in that small setting. I have access to digital pathology, in which the glass slide is then digitized and shared over the internet securely. And I can have Dr. Hanna at the other end review the complex slide and help render a diagnosis or sort through the specific details. In a rural center where I don't have even the luxury of a 10-mile drive, I can see a huge advantage to having both digital pathology as well as augmented intelligence help me practice at the highest level of my expertise. I'm a general pathologist. I do everything that comes out of surgery, neuropathology, GYN, uh, breast pathology. I do a little of everything, and I'm not an expert in everything. I need experts to share their knowledge with me, and I have an additional expert besides Dr. Hanna, Dr. Rosidi, or other subject matter experts in the field in terms of artificial intelligence that can help me narrow down my differential diagnosis and suggest perhaps additional studies that can nail the diagnosis perfectly. So I see someone in a rural setting who is overwhelmed with complex cases or has to interpret a lot of laboratory data. This software is going to just help tremendously revolutionize what we do. And for patients, it means you're going to get an accurate diagnosis much more quickly than have to wait for something to be shipped out and an answer returned by a letter.
Those are such great points, and my experience also reflects what you're describing. As pathologists, we certainly don't want to blindly use any of these technologies. So verifying and validating these technologies is very important. As pathologists, we're very much used to validating and verifying testing now. So it really shouldn't be any different when it comes to AI. Let's talk about what is the inflection point. ChatGPT. This technology is exploding. Many of our members are testing this technology by asking for answers on what stains or tests to use to make a diagnosis. We pulled this question here on your screen from ChatGPT. The topic, what stains to use when diagnosing a testicular tumor. 3 suggestions were given. If you notice at the bottom of the page, after the answers and highlighted in yellow, is a suggestion that staining patterns can vary, so it's always best to consult with a pathologist for a definitive diagnosis. We're certainly happy to see that. I'm curious to hear what all of you think about ChatGPT, some of the pros, the cons, and concerns. I'll start with Dr. Rosidi.
Sure. Yeah, I think this technology is not going away. It's here to stay. So it's incumbent upon us to figure out how to use it, how to work with it effectively, and how to really get the most out of it. In my experience developing and working on the development of computer vision algorithms specifically, that process always involves a test set. Testing the algorithm with a set of images on which it was not trained to assess the performance characteristics in it, as you alluded to sort of verify and validate that algorithm. So I really know when it works best and when it is not at its strongest. For ChatGPT and many other large language models, I personally don't have that information. I don't know the performance characteristics of those tools yet. I've used it in a non-medical way, but I envision if I were to use it for any medical information, for the foreseeable future, I imagine always cross-referencing the results it outputs with a trusted source of mine, either a pathology textbook, a peer-reviewed manuscript, or an experienced colleague of mine. And I'm still very much in this phase of trying to best figure out how to work with these tools before I blindly trust them.
Well said. Dr. Hanna, your thoughts?
Yeah, I think these language learning models, such as ChatGPT, have really been an inflection point, as you said, and have been able to provide the public and pathologists access to these sorts of technology, and have really boomed in the sense that they are publicly available. The pathologists don't have to go work very hard to be able to access these technologies. You effectively just sign up and have access to them. But what I think it's done is it's really allowed for them to play in this open sandbox and test the technology, become familiar with it, and evaluate it. And just like you said, pathologists are not afraid or know very much how to verify and validate all the tests that they use, especially that's required before using on patient testing. Now, just asking a question and getting a response uh, really requires that we don't just blindly use these technologies, because we don't know the accuracy or performance of all of the outputs that these language learning models such as ChatGPT put out. So I completely agree with needing to really read the results as they are, but not blindly trust them, because we don't know the accuracy of the results that it's putting out. And so, just like they used to say, don't trust everything you read on the internet, definitely don't trust everything that ChatGPT puts out blindly, because pathology is really intended for patient care, where we are providing results and diagnoses for these patients, and these are affecting their lives. And while these may be interesting to read the outputs of these learning models, ultimately they have not been incorporated into patient care today.
Yeah, great points. Dr. Glassy, your thoughts?
Well, I have to confess, I'm a ChatGPT advocate uh, with some caveats. ChatGPT definitely hallucinates. It makes things up. It needs to be verified, as Dr. Rosidi and Dr. Hanna said. So I understand the importance, particularly when you're giving advice, that it's medically sound. But I see a lot of other opportunities for ChatGPT to be used personally as well as in medicine and by pathologists. Some of those involve summarizing the medical record, for example. So, to me, the current use of ChatGPT, it's a generalized model. It learned from the internet, and it has and people and it's good or bad depending on the information it engulfed from the internet. So as we all know, there's truth and misinformation within that body of knowledge that ChatGPT has access. So it's only as good as what it's been trained on. But there are new ChatGPT applications which are customized to only securely look at medical data, or only securely look at the information in a patient's medical record. And any of you that have looked at medical records, there's just a huge amount of information there, and it is difficult to ferret out little pieces of information that might be critical to a patient's care. And that's where the summarizing of complex information can be valuable, because a large language model like ChatGPT can do that much better than a physician or health advocate can do. It can pull out trends, it can highlight little bits and pieces in a nurse's note that you might have ignored as a physician. There are trends in terms of the patient's um, treatment of in the past, trends in terms of the laboratory studies that were done, and I see these customized ChatGPT models as really enabling physicians to provide the best possible care. So again, I'm a supporter with an asterisk, a little caveat saying be careful if you're looking at the generalized model, but when you apply that software technology to localized sites or medical, or the chat is trained only on uh, journals or articles that are peer reviewed, then you've got a wonderful opportunity to engage pathologists and improve patient care. And lastly, I'll just say that patients are going to be using this. So it can't be ignored. Patients are going to be feeding their own laboratory data into ChatGPT, asking for information, their own anatomic pathology results, And we need to prepare for that new future, that new opportunity. And also, patients are going to want to be able to understand their path report. And to be honest, ChatGPT has done a very good job at summarizing some complex pathology reports in language that patients can understand, or even foreign languages. English is not everyone's native language, obviously, and having ChatGPT summarize in Mandarin or Arabic or French or whatever the family's normal language is, that can be very powerful in allowing the pathologist to better communicate their results to family and the patient.
So, Dr. Glassie, you gave us a lot to unpack there, and I think the focus on how patients will use ChatGPT is really interesting. Um, if a patient is using ChatGPT without a gate, just the ChatGPT sort of trained on the entire internet, um, it seems to me like although there is some great information out on the internet, we all know there's also some misinformation on the internet. So, Dr. Hanna, how do you see this playing out for patients as they use ChatGPT to interpret their pathology reports?
Yeah, I think we have to take a step back and see how these models were trained. And so there are good resources on the internet, and there are resources on the internet that may not necessarily be as accurate. And so, as these language learning models have been scraping the internet across far and wide, there is inherent bias in a lot of the outputs that it may result. And so, I remember reading an article about how another model was supposed to predict whether ChatGPT or another language learning model actually was the one who resulted uh, some text, and they actually fed through the U.S. Constitution through it, and the model actually predicted that ChatGPT wrote the U.S. Constitution. And so we know that there are some bias and, of course, false positives that might be happening. So these language learning models like ChatGPT effectively need to be uh, fact checked, so to speak, but have a lot of significant promise because of the ability that they have to summarize vast amounts of information and pull out information from different silos of databases across the internet. And so while there are plenty of resources that do have accurate information, and ChatGPT may be uh, apt to be able to pull that data together, one has to be careful in the misinformation it might include in some of its bias and some of its results.
Thank you, Dr. Hanna. Um, I think folks are probably very interested in what's next for AI and where is it headed when it comes to pathology. I know there are more tools that are being developed that pathologists aren't currently using. Dr. Rosidi, can you talk a little bit about that?
Absolutely. I think, a few questions ago, Dr. Hanna touched on a lot of algorithms that are available for the use of pathologists. But it's important to emphasize that we really are on the bleeding edge of this technology and the cutting edge. And the number of tools is, in my opinion, relatively limited compared to the vast tasks that a pathologist has. And so that's one limiting factor. I think the other is sort of something that has been sort of said, potentially not directly, but that digitization, in other words, the conversion of glass slides to digitized whole slide images, is a very necessary step in order to even be able to use the tools that are out there. And this is a significant barrier for a lot of laboratories, and is probably the reason why most laboratories still do use glass and microscopes. The process itself can be very labor intensive and time consuming. It requires expertise, requires significant investment, and some view it as redundant. Of course, it is the gateway to allow us to use the tools that exist, and also the potential for future tools that can do even more. And so it is important that we push on this path forward, because one of the takeaways from this discussion is that these tools hold great promise for our patients. Future tools will most certainly do the same. And so incorporating them more and more into the pathology practice will be key for pathologists and for patients.
Thank you, Dr. Rossetti. You brought up something very important about cost. So I'll ask Dr. Glassie, how do you see um, hospitals and academic institutions dealing with the cost for this technology?
Well, that's quite a hurdle. There are many, or actually the majority of medical centers in the United States have an extraordinarily thin margin or have lost money over the last years, much of that driven by issues around COVID and taking care of those patients. And so asking hospital administration to add on an additional, hundreds of thousands of dollars to add digital imaging and artificial intelligence algorithms is going to be a challenge. So you need to be creative, So one opportunity would be to, work with the hospital foundation. There may be some generous folks there that would like to support this activity. Second, what calls back to what you mentioned at the beginning about the importance of pathologists doing this as opposed to pathologists that don't. I mean, the patient is the center of what we do. And in order to make the right diagnosis, if I need an algorithm, if I need digital pathology, I need to be able to implement that technology to be sure that that patient is taken care of. And in the long run, there will be cost savings. There'll be efficiencies. There'll be the appropriate care given. Precision medicine, we talked about that. Artificial intelligence, augmented intelligence allows patients to receive tailored therapy that works just for them as opposed to the broad population. And so I think these tools eventually will absolutely, positively pay for themselves in terms of one, patient satisfaction, two, insurance companies realizing that those pathologists that are using this technology are resulting in fewer tests being performed, unnecessary tests being performed, and three, patients are going to receive their answers more quickly, and then therapy can start more quickly as well. So there's many reasons for adopting and overcoming that hurdle, that financial hurdle. It's going to be a challenge, but I think we need to be able to advance the profession, advance the health of patients by adopting them.
No, you make a great point. I mean, little is more expensive in medicine than getting the wrong diagnosis and then going down an incorrect therapeutic rabbit hole. Certainly here at the CAP, we are doing a lot of investigating. Our Artificial Intelligence Committee has formed a practice integration and education for AI project team. This is focused on education and technical issues, particularly related to verification and performance monitoring of these tools. The AI committee is responsible for coordinating and aligning AI and machine learning across the CAP, specifically looking out for our patients. So let's now go to some of our reporter questions. And as a reminder, we will answer as many questions as time allows. If we don't get to your question, our media relations team will reach out to you to get an answer. So the first question I'm seeing is, are there potential limitations of incorporating AI into pathology practice? Dr. Hanna, would you like to take that question?
Sure, that's a great question to ask. And in fact, the limitations really will stem from not properly validating or verifying or monitoring the performance of these tools over time. And so, used in isolation, these tools, before they are actually used on patient tests or used as part of patient testing, these tools should and have to be verified or validated, which effectively means seeing the performance of those tools and how a pathologist would be using them in clinical practice. And so with proper verification or validation, you will uncover where those models may have more false positives or false negatives, where it's miscalled something that's benign as tumor, or where it's called something tumor that was benign. And so understanding the performance characteristics of the models before actually using it in patient testing is a common practice that pathologists have to do and are required to do. So The limitations with a proper validation are still possible, as even after a model's been properly validated. If the patient population shifts, as we saw with the public health emergency, there are times in medicine where medicine changes and it may shift suddenly. And so looking at how the model may shift or drift slowly over time is really important as an ongoing monitoring of any properly verified or validated machine learning test as part of a clinical patient test that's used in pathology. And the only other small caveat is we are still learning the human computer interaction as pathologists are using these tools. And so, will a pathologist who doesn't have, say a pathologist who doesn't necessarily have expertise in one area be tricked up by a machine learning model that's pointing a big red area at a benign, a big red arrow at a benign area, but calling it tumor? Will that affect the pathologists who should be expert trained in their area? And so we're learning how that human computer interaction is. With proper, of course, pathology training, the pathologist would be able to differentiate what's truly benign and what might be a tumor area. But those are potential limitations in decreasing the specificity of a pathologist who may not have had access to that because they wouldn't necessarily have had a false positive area be seen as that. So I would say those are the potential limitations of incorporating these AI type systems in patient care.
Thank you so much, Dr. Hanna. We have one more question, and I think this would be great for Dr. Rosidi. How do you envision the pathologist-AI relationship evolving over the coming years?
Yeah, absolutely. I think that I love that question because it focuses on the pathologist AI relationship. And again, that's what we have to keep in mind. I think Dr. Hanna touched on it. These tools have to be tested alone, but they must have a second test and they must be studied with the pathologist. I think that with any new technology, the technology changes, but the user's use of it might evolve over time. Um, Typically, pathologists, like most folks, are suspicious of new tools, and it's healthy. And so, with time, I think pathologists will understand the nuances of these tools, potentially understand their strengths, understand their weaknesses, and really know at what point potentially a pathologist should step in more in the diagnostic process, and at what point a tool like this might be better suited for the task as opposed to a human. And that is a process over time that involves education about digital pathology and the use of AI in that process, and also about the specific tool that the pathologist is using. And it's going to be a process. We can plan as much as we want to study these tools, but we will undoubtedly discover new things as these tools become more and more incorporated into practice. And I think the CAP has been central in codifying that knowledge and really vetting it and spreading it across to its members.
Thank you so much. Dr. Glassie, I'll give you the last word. Would you like to weigh in on what Dr. Rosidi was just commenting on?
The two experts on this panel are Dr. Rosidi and Dr. Hanna, and I'm just the end user. I'm the community guy, but I need help. And so I'm looking to these experts to provide me additional support and tools, and that's going to be in pharmaceuticals with Dr. Rosidi working on new drugs and using augmented intelligence to help come up with new formulations. And for patients, it's going to be Dr. Hanna who's going to come up with new algorithms that I can apply to my practice and deploy so that my patients in my community can have the benefit of that expertise. So I'm all in on this. I think this is a terrific opportunity. And this whole program was put together by the College of American Pathologists. And we're in the business of educating pathologists about how to use these tools. We have new subcommittees involved in this. We have a new council on informatics with artificial intelligence. All these are going to be opportunities for pathologists. So I'll tell you, this is a great opportunity for medical students to be on the cutting edge of technology, benefiting patients, and applying informatics tools to make themselves the absolute best pathologists they can be. So I think this is just a great time to be a pathologist.
Oh, thank you so much. We've certainly heard a number of different specific applications or use cases. Before we close out, Dr. Rosidi, is there another specific use case that you can share with the group that we haven't touched on? Dr. Hannah, I'd love for you to weigh in as well, but I'll start with Dr. Rosidi.
Sure. I think that a lot of the focus of these tools has very much been in, as we've touched on, the assistive mode, in a way that the pathologist works with the AI tool because the AI tool is really doing something that a pathologist would also do, and a pathologist can evaluate that output, decide to incorporate it into their diagnosis or not, and as we've touched on, this can help the diagnostic process in terms of timeliness and in terms of reproducibility and in terms of accuracy. What we haven't touched on, and I'll give you a little preview, and I'm sure Dr. Hannah will give us even more, are the potential for these tools as biomarkers, essentially to look at the digitized histopathology image, which is created always for the diagnostic purpose, but perhaps extract a piece of information that a pathologist on their own, just by looking at the image, would not be able to do. I alluded to it earlier at the very beginning of our discussion when I talked about artificial intelligence algorithms that can analyze the tumor tissue within a histopathology slide and potentially screen it for genetic mutations that exist in that tissue. That can be done in a laboratory now, but it involves genetic analysis and a very sort of time-consuming, complicated process that can be very costly, but it's highly accurate. These tools offer the possibility to do a similarly accurate process directly from the histopathology image. That way, the patient gets potentially a genetic result much sooner, and treatment targeting that genetic alteration can begin sooner as well. Again, this is in its early infancy, but this is a preview of the potential for these technologies to add more to the pathology process and also help patients.
So just like the microscope, this helps. Go ahead, Dr. Hannah.
I completely agree with Dr. Rosidi. I think we've talked a lot about how improving accuracy here is possible, but really the discovery of what's out there and what these machine learning models do quite well is amass large amounts of information, again, across all of these various silos in medicine and put them all together. And so there are there's the early underpinnings of being able to train over a large cohort of patients, their outcomes based on the representation of what's on that patient's tissue. And so if we can, or if there can be these machine learning models built that ultimately can predict patient prognosis, predict patient response to treatment, predict all of these other patient outcomes that we are ultimately trying to do within pathology and in medicine, these machine learning models can take these large, vast data sets and at least try to predict that. Again, that they still need to be properly vetted, validated, verified. But I think this potential promise in the discovery aspect is a really exciting part of where machine learning might be taken in the medical field and in pathology.
Absolutely. So just like the microscope, these tools will help physicians, in particular pathologists, see beyond what we can see today. Thank you for these great questions. Our time is just about up, but before we go, I would like to thank our panel of doctors, Dr. Rosidi, Dr. Hannah, and Dr. Glassy, for their expert insights. I want to remind everyone who joined us today that pathologists are physicians and clinicians who touch all aspects of medicine, from testing through diagnosis. We plan to revisit this topic as the technology continues to advance. Please visit our multimedia newsroom to view this briefing again and for other information about the clinical practice of pathology and pathologists. As you write and report your stories, please make sure to reach out to the CAP for expert information on laboratory testing and diagnostic medicine. On behalf of the College of American Pathologists, thank you for joining us today.